Welcome to Agent of Wealth Podcast with Marc Bautis from Bautis Financial. In this podcast, Marc helps small business owners and retirees overcome the multiple wealth planning challenges involved in your financial life. We do this by creating comprehensive wealth management plans to guide you towards financial freedom, ensure you never run out of money, and help create a balance in life that prioritizes what is most important to you. Join us for this journey as Marc draws from years of expertise and guest experts to solve the multiple wealth planning issues involved in your financial life.
Hello and welcome to the Agent of Wealth with Marc Bautis of Bautis Financial. Today's discussion is about Medicare, and this is going to be handed over to Marc and his returning guest, Victoria Finlay. Good morning, everybody. How are you?
Good morning, Eric. How are you?
Fantastic. Hello, Victoria. Welcome back.
Thanks for having me. I'm excited to be back.
Yeah, so we're talking about Medicare today. Actually, I'm here to learn, obviously, but you guys are talking about Medicare. Why is this being brought up right now?
So we're bringing it up now because every year Medicare has an open enrollment period from October 15th to December 7th. And that's any one that's on Medicare, that's their opportunity to look at their plan and determine if they want to make any changes to it.
Nice. So it's a very timely topic, and it's important to push this out. And anybody who has questions, we're going to give a phone number at the end for you guys to go ahead and contact their office. But for now, I'm just going to sit back and learn from you guys. Marc, take it away.
All right, so let's get started. So we really wanted to focus on what someone's options are during this open enrollment period. The way Medicare works, when someone turns 65, they turn over to Medicare. There are a couple of reasons or exceptions why they wouldn't, but everyone is very familiar with Parts A and B, which are the basic parts of Medicare. And really we wanted to focus on why A and B aren't enough, and there's the other Medicare options that someone has, and what they should go into considering them. So Victoria, if we could start off, what else or why what are Parts A and B, and why aren't they enough to cover all of a retiree's healthcare expenses during retirement?
Well, Marc, so a lot of people think that Parts A and B are just enough, as you said. And one of the main reasons that is not enough coverage is the fact that there's no limit on the out-of-pocket spending. So when you include all the deductibles, co-payments, co-insurance, and then any other expenses that might be related, such as serious illnesses, chronic conditions, or lengthy hospitalization periods, all of that can really add up. So you want to make sure you're covered for that so that these expenses don't keep building on each other. And then you're wondering, when is this ever going to stop? So even though you might not experience necessarily a serious illness or what it may be, even if you just end up in the hospital for a bit of time, that can be a very pricey expense by itself. So you want to make sure you're covered for something like that. And then on top of that, another reason why Medicare Parts A and B aren't sufficient is because there is no prescription drug coverage. So even if you're not currently taking any prescription drugs, it doesn't really matter, because right now what we're concerned about is the future. And so you may end up needing something like that along the lines in the future. So it's important that you make sure you are properly covered for any future prescription drugs.
Okay, so I think that's one of the big things that is misconstrued, or that people think that once they go on Medicare, every single medical expense that they have is covered. And today we're going to talk about some of the private insurance options that people have to supplement that coverage. So let's start talking about some of those options. Okay,
great. So there's three major options, and the first one has to do with if you're still working and you're 65 or older. So if that applies to you and you're still working and you're covered by your employer's health insurance plan, then you probably are adequately covered. But again, you want to check and make sure that that is the case and that you do have all the coverage that you may need. And on top of that too, sometimes your employer's health insurance plan isn't that great. So if you are 65 or older, it is recommended most of the time that you do stay on your employer plan and defer Medicare. But if your employer's plan covers 20 or more employees, that's when it's best for you. If the employer covers less than 20 employees, it actually is probably better to look at your Medicare plan. And then the second option to close this gap between what parts A and B do not cover are to go ahead and look into a Medigap policy and get that Part D prescription drug plan. And then the third option is to look into a Medicare Advantage plan with drug coverage.
Okay, so we're really looking at three options. If you have the ability to stay on your employer plan, a Medigap policy, Medicare Advantage policy. And just to break it down, one stat is 71% of retirees are on or have the Medigap coverage. 29% are on Medicare Advantage. However, those numbers are a little bit misleading because the 29% on the Medicare Advantage, that number is actually increasing. So we're seeing a shift from people go on Medigap, which is called your traditional Medicare, and they're moving towards these Medicare Advantage policies. So part of what we'll do today is we'll talk about what Medigap is, what Medicare Advantage is, Part D, your prescription drug coverage, and how to decide on choosing coverage. But also, even more importantly, once someone goes on Medicare when they're 65, they basically don't change coverage. They stick with their coverage, and in some cases, that may be the right decision or the right thing to do. But these coverages are always changing, as well as your healthcare needs are changing. So we wanted to really emphasize that it makes sense to focus on, every year looking at your plan, looking at your healthcare needs, and deciding if it makes sense to change plans. But let's start talking about Part D, which is the prescription drug coverage.
Okay, great. So first and foremost, prescription drug coverage is offered through private insurers. So there are two different options with this. The first option is to get coverage through a standalone plan. And then the second option is to get coverage by signing up for a Medicare Advantage plan. Now, there's one main difference between these two. And the first is that if you were to choose a standalone plan, the beneficiary of this plan must have Part A or Part B. Whereas if you chose the Medicare Advantage plan, the beneficiary must have both Parts A and B. So that's a difference right there, where it's an and situation rather than an or situation. So that's important to note. And now, regardless of what you end up choosing, whether it be the standalone plan or the Medicare Advantage plan, the average beneficiary is looking at a choice of about 29 plans. So it's really good and important to go ahead and analyze all of your different options and see what looks like is the best plan for you and your situation, whether it's based off of your needs and lifestyle or just your needs. But go ahead and take a look at all of your options that are provided. And now, of course, one of the main questions people are wondering is, how much is this going to cost? So there is a little bit of a range depending on what plan or what coverage you end up getting, but the monthly premiums range from $15 to $132 a month, which averages out to about $40 per month. So that's not a bad average, but again, obviously there's that range, so you can be on the lower spectrum or the higher spectrum. And then again, I said this earlier, but it's important to note that even if the retiree isn't currently taking any prescriptions, they should still sign up for prescription drug plan, or else they will face a late enrollment penalty when they do need to sign up, which can be very expensive.
Yeah, I think that's one of the common themes with Medicare is that, and I'll say common and confusing themes with Medicare is that there's all these late enrollment penalties. If you don't sign up for Parts A and B at this time, or Part D or Medigap policies, and you do sign up at a later time, they enforce these late enrollment penalties. So it's important to know when you have to or when you should sign up for different aspects of Medicare, and just make sure that you don't miss those deadlines, even if you don't particularly need that coverage at that time. But what are some of the firms that offer Part D?
So there are three major firms that people tend to use, and those three firms are United Health, Humana, and CVS Health. Those are all covered by Medicare D, obviously, but they actually cover about half of the Medicare Part D enrollees. And even though those are the major firms, there are other options. So it's important to go ahead and look at those options as well, because again, everyone's situation is different and those smaller plans might be better for you. So don't rule those out and make sure you include those in while you're looking through the different options for Part D.
Yeah, I was surprised to see CVS Health on there. I know they have obviously a big pharmacy, but you think of it as just a store. You go in, you get some Tylenol, you get some Snickers bar, but they're a big player in the providing Part D prescription drug plan. So it ranges from these enormous healthcare companies, insurance companies, to some of the smaller ones. And I think, like you said, is don't rule out the smaller ones because their plans are just as good, and can be a lot cheaper as well. What's the best process? Or I think that's also can be overwhelming to someone. Is they may be on prescription drugs, they may need prescription drugs, but figuring out how do I evaluate? You mentioned they have 29 different options to choose from. How do they go about picking the best plan for them?
So Medicare actually offers a great resource, which is just their website. So what you can do is log on to medicare.gov, and they have a great plan finder. So what you're going to do when you log on to their website is first you're just going to enter in your zip code and then select the Find Plans option. From here, they're going to ask you for some basic info about yourself and the current insurance coverage you have. So make sure you have that on hand. That way you can properly fill this out as accurately as you can. Obviously, the more accurate the results will be to help figure out what prescription drug plan is best for you. Once you've entered in all your basic info, the next step is going to be entering in any prescriptions that you're currently taking. If that doesn't pertain to you, you can go ahead and skip this section, but just beware that might change your results a little bit at the end. So just want to give you a heads up that it might not be the most accurate results once you finish all these steps. And then once you enter in what your prescription is, you want to know if this drug is covered, obviously. So it'll pop up with results and tell you what the co-payments or co-insurance amount are for each of these drugs. And then once you've entered all that info in, it's going to give you the out-of-pocket costs based on the particular drug and the coverage options. So that way you have an idea of what it may cost. And then the third step that's going to pop up for you is picking out your pharmacy. So it'll provide you with a list of plans. Again, back to those two options of either standalone or Medicare Advantage plan. So it'll give you options for both of those. It'll give you a list of plans for both of those options with the drug coverage that you're looking for. And then since it gives you a list of everything, you can go ahead and do a side-by-side comparison of all the coverage options and decide which option might be best for you based off of the cost and the coverage that you're looking for. And from there, you can also go ahead and refine your search for any other particular situations that pertain to you and what you're looking for with your coverage.
Yeah, and just so everyone has the website, the Medicare website, it's medicare.gov. And one of the really cool things about it is you can actually enroll in a Part D plan right from that website. Or you can enroll through the actual provider. And you usually want to do this if you have specific questions about the policy that you want to ask them. Some of the things you want to consider, whether these are questions you ask the provider or just things you kind of do when you're doing the analysis that you go through, but you want to look at which plans cover the prescriptions that you take, which plans, obviously gives you the overall best price on your prescriptions, what's the monthly premium, yearly deductible, co-insurance, or co-payment, which plan allows you to use the pharmacy that you want to. Maybe you like to get prescriptions through the mail, so you want to check that your plan allows you to do that. If you travel a lot, or if you have families in different states, you want to consider or make sure that you'll be able to use the pharmacies wherever you travel to. You want to look at the plan's quality ratings. Does your plan's coverage start when you want to? And then, how is it reacted to unexpected drug costs in the future, or what can you project? Do you have any protection if a particular drug raises its price in the future, or are you on the hook for that raise? So lots of things to consider. Like Victoria said, Medicare.gov has a great analysis tool. We've walked people through that tool to really help them kind of hone in on which plans they should be considering and kind of how to make that final choice. So we're happy to do that, but it should be intuitive enough that someone can go in, put what prescriptions they're on, and that plan finder will put together a pretty good side-by-side comparison of the different plans available. So now we'll segue into Medigap insurance. And what Medigap does, it supplements the original Medicare, so Parts A and B, and it pays certain costs or certain expenses that Medicare doesn't cover. One good thing about Medigap is that the policies are standardized, so they must offer the same basic benefits no matter who you're buying the policy through. However, costs can vary widely, so shopping around makes sense. And going back to this theme of do a checkup on your policy each year. These premiums, these prices can change. So again, it definitely makes sense to do an analysis and look at which Medigap or Medicare Advantage policy you have. The two most popular ones are Plan F and Plan G. And if anyone's familiar with Medigap, it's this alphabet list of all these different policies that cover different things. But Plan F and G are very popular because they provide the most comprehensive coverage. And you almost get to this fully insured state once if you go with the Plan F or Plan G policy. But even with this fully a lot of your healthcare expenses are covered, it still doesn't cover everything. Victoria, what are some of the things that the Medigap policies do not cover?
So there are a few major things that the Medigap policies actually don't cover, like you said. And first and foremost is long-term care. Now, this is really important because actually a lot of people are under the impression that this is covered with a Medigap plan. And again, obviously that's not the case. And if you were to experience any long-term care costs in the future, those can be very expensive. So you definitely want to prepare for that and understand that that is not covered in this Medigap insurance. Another thing that's not covered under this policy is vision care, dental care, and hearing aids. So those are four major things that aren't covered. And again, you want to make sure that you have this coverage. So consider this when you're looking into your coverage because you want to make sure you have all areas. And again, back to that long-term care section, that is something that can really be expensive in the future. So you want to make sure that you can either self-insure or you look into some separate long-term care insurance coverage for that.
Yeah, I think the long-term care, why people think it's covered by Medicare is a lot of people get Medicare confused with Medicaid, where long-term care is covered. However, if you have a certain number of assets or income above a level, it's difficult to qualify for Medicaid. So under Medicare, though, which is the retirement system or healthcare in retirement system that we're all on, long-term care is not covered. So like Victoria said, it's either you are looking for a separate policy to cover it, or we have to figure out a way to self-insure. Is there anything else that is not covered by Medigap?
So I know I listed briefly before that vision care, dental care, and hearing aids are not included in Medigap insurance, but what you can do to cover those is get their own separate plans so that you are covered in case you do encounter anything that might be listed under these options.
Okay, so it was like basically just for everything, there's a plan for that. You can get a plan if it's particular coverage you need or want to get. The other characteristic I want to talk about Medigap is this concept of guaranteed issue. We all think of health insurance and we think of pre-existing conditions and whether we're actually insurable or not. And the rules around this guaranteed issue, meaning the insurance company is required to give you a plan whether you have a pre-existing condition or not, are a little bit confusing. So I just wanted to clarify them a little bit here, where the way it works is if you enroll you're eligible for Medicare at 65. You have 6 months after that to enroll in a Medigap policy where you will have a guaranteed issue, meaning that you will be able to get a Medigap policy no matter what or if you have any pre-existing conditions. If you do not enroll in a Medigap plan at that time, so let's say sometime down the road, you're 66, you're 67, you're 70, and you decide that you do want some supplemental coverage, the Medigap insurer is not required to give you a plan. They can basically look at your pre-existing conditions and decide if they want to offer you a plan or not. So again, this is one of the things where, we talk about all these deadlines and these enrollments. When you turn 65, you really want to consider whether you're going to get that Medigap coverage or not. And the other thing that's important about Medigap is, I mentioned earlier that the prices vary widely. So you want to understand how the premiums are priced. The different carriers price them differently. And there's really three different options or ways that they price them. The first one is called community rated, which is the same premium is charged to everyone based on age. There's also something called issue age rated, where the premium is based on what age you are at the time you buy the policy. And then the third is attained age. The premium's based on your current age that you are now. And these all can change. So whatever's cheapest when you're first looking may not be cheapest down the road. So again, it's another piece of analysis that has to come in. And I guess, Victoria, does someone shop for a Medigap policy similar to what you covered on the Part D prescription drugs?
Yes. So that same resource again, Medicare.gov, has this option to go ahead and look at the supplements and insurance section. So what you're going to want to do is, again, go to that website, click on that section, and then from here you can start with a plan and see which companies provide options, so you can get a list and see what coverage options are out there for you.
Okay. And I guess, is there certain questions that they should be asking the insurance company if they're comparing a plan and have questions about it?
Yes. So there's definitely questions you want to be asking when you do this. This is going to help you determine what plan is best for you, because all of these have, depending on the answer, can change the plans that are provided and what you're looking for. So the first question that you're going to want to ask is if they use medical underwriting for this Medigap policy. Another question that's important to ask is if they have a waiting period for the pre-existing conditions, because some people that are looking into Medigap insurance might come in with pre-existing conditions, whether it's something that can be cured or can't be cured. It's important to note this. Next question that you should be asking is, I am X years old. What will my premium be under this policy? Obviously, the cost of this plan plays a big role in determining if it's the best option for you. Another question you should definitely be asking is, has the premium for the Medigap policy increased in the last 3 years due to inflation or for other reasons? And if they answer yes to this, you're obviously going to want to ask how much it has increased by, to give you an idea of what your future costs may be inflated by. And then the last question you're definitely going to want to ask is if they offer any discounts or other benefits, because this can play a role in obviously your coverage and how much you're going to be paying. So definitely take a look and make sure to ask these questions before you determine what plan is best for you.
Okay. And the last type of plan that we wanted to talk about are the Medicare Advantage plans. And with this, you can kind of think of it as like your combo plan. It provides all care under Parts A and B. Most of these plans include the Part D prescription drug coverage. And some of those things that we talked about that Medigap doesn't cover may be covered under, or most likely are covered under the Medicare Advantage plan. And that's like vision, hearing, dental, wellness programs. So they do simplify a lot of it. However, there are a couple of nuances that you have to consider. And the biggest one I think we see is that you have to use the plan's network of providers. So one question whenever I talk to someone about Medicare and their options they have is usually, can I keep my existing doctors? And under Medigap, you can, as long as the doctor accepts Medicare. However, Medicare Advantage, the doctor has to be part of the network. So that's one big thing that people have to consider about these types of plans. Like I mentioned earlier, they are becoming more popular. The other big thing about it is you cannot be denied enrollment based on your health status. And you can use the similar plan finder at Medicare.gov, and you can even enroll in the plan from that website. So that's the other big option. In addition to Medigap are these Medicare Advantage plans. And let's talk a little bit about comparing the Medigap versus Medicare Advantage and how someone would make that decision on which plan is best for them.
So everyone's going to be different. And for some people, they might have a very clear choice as to what option is best for them. And then in some cases, you're going to have to see what option is better by weighing the pros and cons of each option and seeing what you're looking for based off of your needs. And with a Medigap policy, you can see anyone who accepts Medicare, whereas, like Marc just said, with Medicare Advantage, the doctor has to be within your network. So that's really important to note, because you might be covered right now under one certain doctor, and then once you were to take on a Medicare Advantage plan, you might not be covered by that doctor anymore. So you definitely want to weigh that when you're making this decision. And also Medigap policies, those tend to be more stable because they don't have annual changes, whereas an Advantage plan, those people that have those plans are going to have to renew the contract with Medicare every year. So that's something else to consider when you're looking at these plans.
Yeah, and I think to summarize, Medigap tends to be better for people who go to the doctor a lot, while Medicare Advantage tends to be a little better for people who tend to be healthy. And the premiums are reflected in that. However, you do have to be careful, because if you are under a Medicare Advantage plan and you do use healthcare a lot, it could be a more costlier option. But to close this out, and we want to circle back to open enrollment, which starts the second week in October. But each fall, anyone that's has a Medicare plan or one of these supplemental plans, you should get a packet in the mail that will outline how your plan will change for the upcoming year, and really should take advantage of that open enrollment period each year to do that analysis. You have options. You can change. Let's say you're on Medigap, and you can change from plan F to G or to H or to a different plan. You can change insurance companies within a plan. So you can stay in plan G, but change from United Health to Aetna. Or also you have the option of changing from Medigap to Medicare Advantage. So you do have decisions to make. And then there's also obviously the prescription plans with things changing on which prescriptions you're taking, in addition to how the insurance companies cover those prescriptions. They might 1 year stop covering a particular drug, and you just have to find out, somewhere else that, in a different plan that provides coverage for it. So there's a lot of decisions or a lot of analysis that you have to do. We're happy to walk someone through that, analysis. You can reach us on our website, bautisfinancial.com, or call us at 862-205-5800. And Victoria, thanks for being on today.
Thanks for having me. It was great to be back.
Thank you, guys. This was educational. I've got a ton of questions, which we don't have time for, which is okay. But because I can always call you and ask those questions, and so can anybody else. But I do have one question. Victoria, you did a great job of listing a lot of questions that people should be asking, and I appreciate that. But I do have to ask, do you have that list available anywhere so that somebody can see that? Because I was not able to write down those questions as fast as you were saying them. So where can somebody find those?
Yes, so we will list all of we have checklists, other resources, including flow charts that'll help you, decide between all these different options.
Nice.
And you can find them at the episode website page for this podcast, which is agentofwealth.com/28. And we'll have plenty of resources on there, which can help you out.
Perfect. Okay. Thank you so much, guys. This is fantastic.
Thanks, Eric.
Thanks for having me.
You bet. And thank you all for listening to the Agent of Wealth podcast with Marc Bautis. If you have not subscribed to the podcast yet, please click the subscribe now button below. This way, when Marc comes out with a new podcast, it'll show up directly on your listening device. This makes it much easier to share these podcasts with your friends and family. And think right now, there's somebody that needs to hear this specifically. As they approach that age for Medicare, they're going to hear this podcast and realize there is a lot of information they probably don't know and they need to know. And the entire Bautis team is fantastic as a resource. So please share this with them. Again, thanks for listening today. For everyone at Bautis Financial, this is Eric Johnson reminding you to live your best day every day. And we'll see you next time.
Thank you for listening to the Agent of Wealth podcast. Click the subscribe button below to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of Bautis Financial. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment and financial planning.